we have a big political transition that's about to happen, and it's quite important to get the policies right, especially when it comes to the health crisis as well as the economic crisis. But before Zai discusses the budget aspects of the health and how the government plans to spend next year, let me just lay down some context for that discussion by discussing to you some of the economic milieu that we're working with. So the first thing to say is that we're still reeling from the country's worst economic crisis since World War II. Last year, the economy contracted. Lumit po economy natin by almost 10%. And it actually peaked nung second quarter of 2020 when our economy contracted by almost 17%. In more recent quarters, actually medyo mas nakaka-recover na po yung ating ekonomiya. In fact, just the other day, it was revealed by the Philippine Statistics Authority that the economy grew by about 7%. Which is lower than the 11.8% growth in the second quarter, but still quite respectable. And it goes to show that the economy somehow is recovering, but still far from the pre-pandemic levels. Last year, because of the record contraction of the economy, we were actually ranked as one of the countries that had the worst economic contractions, not just in ASEAN, but also in Asia in general. And various think tanks have shown that actually it will take us quite a long time to go back to our pre-pandemic trajectory. As you can see here from the graphs from different think tanks, the economy contracted substantially as the pandemic started, and it will take quite some time before we can go back to that upward trajectory before the pandemic struck. In fact, the NEDA, National Economic and Development Authority, itself said that the recovery may take about 10 years. And actually, malaki yung economic impact in the coming decades. They estimated that it will cost the economy about 41 trillion, a trillion with a T, pesos in the next 40 years. Kasi alam po natin na maraming mga negosyo ang nagsara, maraming nawalan ng trabaho, but at the same time ay marami pong mga estudyante ang nagkaroon ng learning losses because of the closure of the schools as well as the difficulties they encountered with online learning. So that in itself will have repercussions for the future growth of our economy. So meron pong mga economic scars that will be left by this pandemic. The recovery, as I mentioned, is proceeding, but it's been shaky. And somehow related siya doon sa mga lockdowns ng gobyerno natin. As you know, in the past months, as the virus spreads exponentially, the government has had to impose some strict quarantine restrictions, and that affected the recovery of the economy. Ang daming nagsasara, ang daming nawawalan ng trabaho, and at the same time, they're not receiving enough economic aid from government. Before the pandemic, as you can see, pataas yung ating production as measured by GDP. But we have quite a ways to go pa before we can go back to that trajectory. And yung sinabi ko na 7% growth, that in a way is quite illusory because we're comparing against the nadir of the economic crisis in the second and third quarters of 2020. So nanggagaling po tayo sa mababang antas ng production. So kahit small improvements in production will register as a high growth rate. So we have to temper our expectations, or when it comes to reading the GDP figures, we have to know that context. When it comes to the specific factors behind GDP, we know that it's consumption spending as well as investment spending that contracted the most. Investment spending is quite important because many people have stopped expanding their businesses or investing in equipment and other things that they need, and that has implications on future growth. When people do not invest, then we can expect slower growth in the future. At the same time, when it comes to the different sectors, you can see that it's services that really contracted as well as industry because many of the face-to-face interactions in the economy can be found in these sectors. Agriculture turned out to be more robust in a way, but actually in recent years, we have also seen shortages when it comes to meat, vegetables, as well as fish, and that drove prices up. When it comes to the different sectors, again, you can see that although agriculture and services seem to be recovering, industry is having a hard time. And this includes, for example, construction, mining and quarrying, utilities, etc. And we need to accelerate the recovery of industry to catch up with agriculture and services. When it comes to services, as you can expect, many of those that closed down can be found in trade, retail trade, as well as accommodations and food services, hotels and restaurants. And in fact, we learned a few months ago that actually Automatic Center, the Philippines' oldest appliance chain, had to shut down after several decades in the country. When it comes to the mobility of Filipinos as well, Filipinos have been staying at their homes for the most part during the pandemic. And you can see that mobility in public places such as retail and recreation areas, parks, and offices have not yet recovered their pre-pandemic levels. Although people have been going back to groceries and pharmacies, pero when it comes to other public places, they haven't been going back as quickly. But the situation varies greatly across different regions. For example, in Calabarzon, many people have since gone back to groceries, malls, and parks. So it really depends on the location or where you are and how confident people are there when it comes to not contracting the COVID-19. You can see as well some regions such as Ilocos have a harder time recovering when it comes to mobility. And you can see that as cases rose significantly in recent months, then many people stayed away from public places and mobility contracted as well. When it comes to businesses, so many businesses have actually closed down. So we know from certain surveys that as many as 70 or as many as 75% of firms have closed down temporarily in April of 2020. But more disturbing still would be the proportion of firms that are permanently closing. Kasi mahirap pong mag-recover ekonomiya if so many businesses have permanently closed down. It's that much harder to get back on their feet, and we can see this across different sectors. With the contraction of the economy, the Filipinos' average income has also declined to 2015 levels. So it's as if the economic gains in the past 5 or 6 years have been erased by the pandemic. And you can see that the average Filipinos' income has been recovering, but very slowly. When it comes to the percentage of households with savings, that also dropped to a record low in the middle of the pandemic. So people have been reducing their savings. They've been tapping into their savings and having a hard time replenishing them with their lost incomes and jobs. One survey found that as many as 84% of households saw lower incomes. And just above half of all households will have enough resources to last 2 weeks if they lose all their income sources. When it comes to the labor sector, we can see a significant rise in unemployment and underemployment. And actually, we can see that as many more people are going back to the labor force as the economy has been reopening, but many are still finding it difficult to find jobs. Hence, in September of 2021, the latest labor statistics, we know that as many as 4.25 million Filipinos are still unemployed, significantly higher than pre-pandemic levels. Kasi dati, ang bilang po ng unemployed ay nasa mahigit 2 million lang po. Ngayon na doble. So as you can see, malayo pa talaga tayo dun sa pre-pandemic levels ng unemployment. Oops, ayan. When it comes to SWS, they also have their separate survey. Natagpuan po nila that as many as 13.5 million Filipinos are jobless as of June 2021. So this kind of jives with the official statistics if you add the number of those who are unemployed as well as underemployed. We also have the highest unemployment rate in ASEAN. So we have the deepest economic contraction. We have the highest unemployment rate. And by the way, there's a gender aspect as well to the labor force participation rate, because as the pandemic struck, we saw that many women have gone out of the labor force to take care of their children, monitor their welfare, as well as their online learning. So women's labor force participation really contracted, especially in 2020. But as you can see, more and more women are going back to their regular jobs, especially this year. But I think it's important to take note of that gender aspect in the labor sector. When it comes to the OFWs, as many as at least 1.4 million Filipinos have been repatriated, but remittances have also plummeted as they lost their jobs abroad. And for the longest time, remittances have been keeping our economy afloat and providing our economy with sufficient dollars. But that has been reversed in the pandemic. And for the first time in several decades, we saw shrinking of OFW remittances. When it comes to prices as well, so aside from the contraction in incomes, nawala ng trabaho at income sa mga tao, at the same time, prices are also accelerating. So for all months of 2021, we saw that the inflation rate has been on or above 4%, which is the upper target of government. And so ibig sabihin, bumibilis po yung pagtaas ng presyo ng mga bilihin. And this is driven primarily by commodities like meat, fish, and vegetables. So if you add, for example, the inflation rate as well as the unemployment rate, you can compute the so-called misery index. And you can see that the misery index, which captures Filipinos' economic misery, has reached all-time highs throughout the pandemic. As for the hunger rate, the SWS also found that as many as 3.4 million Filipinos experienced some form of hunger as of June 2021. And according to the Philippine Institute for Development Studies, as many as 5.5 million Filipinos can be pushed into poverty if they don't receive enough economic aid from government. But we have to see yet an update on this. There's also the risk of a K-shaped recovery where the rich will recover much faster than the poor. And this is quite evident, for example, when it comes to online learning, where rich students have enough gadgets and internet access to keep up with the demands of online learning. But those poorer students, poorer counterparts, have a much more difficult time doing that. And we will see likely the repercussions of that in the coming decades. When it comes to the percentage of Filipinos who are economic losers, in other words, sumama po yung kanilang pamumuhay throughout the pandemic, you can see that that has reached all-time high as well, and the economic gainers an all-time low. And when it comes to optimism, when it comes to the economy, consumers are becoming less and less pessimistic when it comes to spending. So more and more people somehow are able to spend their money as the economy reopens. But businesses are less optimistic about the future. And there's still so much uncertainty when it comes to the economy's recovery, especially since the pandemic hasn't really gone away, as I mentioned earlier. So there we have it. The economy is at an all-time low. And the economy is at an all-time low, and the recovery is quite slow. So what can government do? The first thing to do is to spend. But unfortunately, for the past 20 months or so, they have been scrimping. Masyado silang nagtitipid ng pera. For one thing, actually, the Bangko Sentral has been doing its part. It has been reducing interest rates to make borrowing more attractive. And when people borrow for their businesses, their cars, their condos, then that will spur some economic activity. But as you can see, the growth of bank lending has actually contracted. So the policies of the Bangko Sentral seem to be quite ineffective in spurring economic activity. So this puts the burden on the national government to accelerate spending. By the way, these graphs show that the percentage, for example, of non-performing loans, yung mga hindi nakakabayad ng kanilang utang, has also risen throughout the pandemic. And yung credit card delinquencies as well have risen to an all-time high in 2020. So as I mentioned, the government really needs to spend, and some economists have actually projected that that may accelerate the economy's recovery, not just in the Philippines, but also in other countries. So even if that means that the government needs to borrow more to spend on the pandemic response as well as economic aid, that will pay off in the form of a faster recovery. But unfortunately, the response of government has been quite small. So you can see the orange bars here show you that the losses when it comes to the economy are quite significant. But by contrast, the response of the government has been quite small. As you can see in the blue bars here, bayanihan packages. As you know, the government passed the bayanihan packages to address the pandemic, but the total amounts in those packages are quite small, disproportionately small compared to the extent of the economic crisis. And while the Philippines experienced the worst economic contraction in ASEAN, the fiscal response of government, meaning the total government spending, has been quite small, smaller in fact than Singapore, Thailand, Malaysia, and Indonesia, even if they did not experience a deep recession last year. In fact, actually, the government has been quite worried that tumataas po yung ating pagkakautang basically, and that is measured by the debt to GDP ratio. But in fact, it's quite at par with the debt to GDP ratios of our neighboring countries in Asia. And some think tanks as well, for example, the ASEAN Macroeconomic Research Office, have noted that actually there's still room for the Philippines to spend more. There's still fiscal space to spend more to address the pandemic. Kailangan gumastos. Hindi pa sapat yung ginagastos ng gobyerno ngayon compared sa dapat niyang ginagastos. And that brings us to a discussion of the budget, and Zai will discuss this further in more detail. But as you can see, the government has been spending on things that are not remotely related to the pandemic response. For example, for 2021, they increased the budget of the DPWH significantly, but at the expense of the budget of the SWD, which is in charge of the provision of economic aid, as well as the Department of Health of all agencies. So you can see that the priorities of the current government are not aligned with the things that the government needs to be spending on. Some economic managers are worried about the rising debt, and in fact, the national debt has reached an all-time high. In fact, larger now than 11 trillion pesos. But you note that most of that is actually coming from domestic debt securities, meaning that the government has been borrowing from Filipinos themselves and not so much from foreigners and foreign institutions. So the debt to GDP ratio of the Philippines has increased to more than 60%, but still quite manageable in my opinion, and there's room for more borrowing if need be. Secretary Dominguez, however, ascribes to the notion that fiscal discipline will save us. So in other words, ay kailangan magtipid ng gobyerno in the middle of the pandemic. Pero I think this is misguided because the Philippine government really needs to focus on the pandemic response, even as the cases have gone down recently. But of course, there's always the threat of more variants as well as more outbreaks, and we don't want the economy to suffer more. So they really need to focus on the pandemic response. But unfortunately, they haven't been quite willing to spend on that as well as on economic aid or ayuda. So I think that's a big problem. So lastly, to recover, what we need would be, first of all, a competent pandemic response compared to what we have been seeing in the past 20 months or so. So basic things such as testing, mass testing, contact tracing, and effective treatment. Of course, we also need to accelerate vaccination, and we're seeing that somehow in recent months, but not nearly enough if we want to accelerate the economy's recovery. And as well, we need to spend on economic aid for those who are not so fortunate and still having a hard time to get back on their feet. Uh, the positivity rate of the Philippines has reached a very high level in the past months, although that has been reduced in more recent weeks. But I think this is quite dangerous. It only goes to show that not enough people are being tested if the positivity rate is well in excess of 20%. So in that regard, the government has not been spending enough on testing. And when it comes to some studies show that vaccinations are really key. When you want to accelerate the economy's recovery, then you need to spend on vaccines and distribute them efficiently and quickly. But unfortunately, we have been seeing actually an acceleration of the vaccination rate, and in more recent weeks, we have seen that in fact more than 1 million doses can be administered in a day, and that's quite good. But we need to accelerate that even more. And we have to note as well that the Philippines, compared to other countries, has not been vaccinating as fast. Of course, one problem would be the global vaccine inequality, which hinders our access to enough vaccines. But when vaccines come into the country, it's important for the government to distribute them swiftly and equitably. Because we know, for example, di ba, yung sa mga probinsya po ay kulang ang distribution ng mga bakuna kahit na maraming gustong magpabakuna. So government really needs to step up. As for economic aid, unfortunately, some lawmakers have been quite hesitant to provide economic aid, even if some economists in Congress, for example, Representative Stella Kimbo, have been proposing such a bill. For example, Bayanihan 3 was supposed to be about 420 billion pesos in unemployment assistance, business wage subsidies, as well as business loans for micro, small, and medium enterprises, etc. But until now, government has not passed such a bill, and in fact, they have failed to put the same provisions in the 2022 budget. There should also be no health economy trade-off, as the economic managers have been parroting in the past several months. We cannot just reopen the economy without a good pandemic response. Because even if you reopen the economy, if people are still scared of the virus and they're afraid of contracting it, then they will not go out and travel or buy stuff at the malls, etc. So the government really needs to focus first and foremost on the pandemic response before reopening the economy. But for example, the NEDA Secretary, Carl Chua, has been pointing out that, for example, they need to reopen the economy because of the non-COVID deaths that we have seen in recent months. But I think that's the wrong trade-off to put forward. We cannot take care of non-COVID patients if we don't have enough space in the hospitals to take care of them because of the rise of COVID cases in the country. So there's really no health economy trade-off, and we should stop ascribing to that notion. Tarchua also said that the Philippines seems to have focused too narrowly on COVID and not enough on the economy. But again, I think that's another iteration of the false dichotomy between the economy and health. So even if you ask economists right now, they wouldn't say that we should focus first and foremost on reopening the economy. Instead, they would say that focus on the health crisis first and foremost. Otherwise, we will be caught in this endless loop of surge in cases, and then we have lockdowns, and then we have a dip of cases, and then you can reopen the economy until the next surge of cases. So we want to get out of this vicious cycle. So I think the main message here is that we have to fix the pandemic response first and foremost before we can expect any decent economic recovery. So I think that's it. Thank you very much for listening.
Thanks a lot, JC. Excellent. So, Saisa?
Thanks, Doc Marilyn, for inviting me and JC to this webinar hosted by PCPD. And thank you rin to Dr. Tony Bay for the introduction. So as JC mentioned a while ago, we've been doing the rounds. We've been doing this actually since the start of the pandemic, talking about the economic situation and also the budget. So nagsimula pa kami ng presentations namin. Pinag-uusapan namin Bayanihan 1 and then Bayanihan 2 and then the 2021 budget. And now we're in the middle of the 2022 budget legislation. So I will cover that part of the presentation. And I will focus specifically on the health budget. So we'll just breeze through some of the budget priorities in the other sectors of the economy. Oh yeah, before I go into my presentation, I forgot to introduce Eileen. So I'm currently the Executive Director of the Institute for Leadership, Empowerment, and Democracy, where si JC is also one of our board members. We're a non-stock and non-profit think tank consultancy, and we focus on public finance and good governance. So yung ginagawa namin basically is fiscal policy research. We look at the budget, of course. We look at finance, how the budget is basically funded, and also we look at how all of those things relate to the economy, syempre sa tulong ni JC. And we also do advocacy and coalition building. In fact, we just finished spearheading the People's Budget Coalition, which we co-convened with Citizens Budget Trackers, another volunteer-led coalition, as well as the Makati Business Club, to come up with a more people-centered and consolidated 2022 budget. So we, on the side, we also do some business insight and intelligence, again focused pa rin on public finance and good governance, because those two are really intertwined. So yeah, this morning I will focus on the health budget, particularly yung COVID-19 funds. Ano na nga ba yung nangyari doon? And then after discussing that, I will then discuss ano yung proposed budget for health, ano yung nasa executive proposed version, ano na yung changes na ginawa ng Senate recently. So what happened to the COVID-19 funds? Before I discuss that, kanina sabi ni JC, kailangan yung importante yung fiscal policy para dito sa sa pandemic response at sa economic recovery. So titingnan natin ano ngayon yung mga budgets, ano yung sources of funds para sa COVID response at saka itong paparating na budget. So JC mentioned a while ago there was Bayanihan 1 and 2, and Bayanihan 1 and 2, just to be very clear, are not supplemental budgets. They did not they did not increase the 2019 and 2020 GAA. Yung Bayanihan 1 and Bayanihan 2 is basically just an authorization for the executive branch to reallocate or realign funds within the 2019 and 2020 budgets. So bakit kasama yung 2019 kahit na nagsimula ang pandemic noong 2020? It's because the 2019 budget was valid also until end of December 2020. And then of course, we have the current budget, the 2021 General Appropriations Act, which is basically, sabi nga ni JC, misplaced pa rin yung priorities given the narrow focus on the build projects and other non-priority, non-urgent expenditure programs which don't really directly address the pandemic and the socio-economic crisis that we're in. Tapos meron rin yung Bayanihan 3, which was supposed to be an economic aid and stimulus package, but it was never passed because Yun nga, sabi ng Senado, hindi nila ito na ipasa kasi walang naibigay na Certificate of Availability of Funds ang DOF. So basically, yung budget para sa ayuda, kahit na maraming tao yung naghirap, sabi ni JC kanina, mataas yung level ng economic misery, walang doon, walang naibigay na ayuda para doon pagkatapos nung ayuda during the lockdown o yung tinatawag natin sa. So kung titingnan natin yung Bayanihan 1 and Bayanihan 2, magkano yung total na nai-release para dyan? Merong 608.5 billion pesos since Bayanihan 1 was legislated up until June 30, kung kailan nag-expire yung Bayanihan 2. Kung makikita niyo po, you see here 4 bars for each of the fund source. Yung blue bars, that represents the allotment or kung magkano yung nirelease ng DBM papunta sa mga government agencies. Ngayon, hindi sapat na malaman natin magkano yung nirelease. Syempre, kailangan malaman din natin magkano ba talaga yung nagastos, magkano yung nagamit ng mga government agencies. So the darker blue bar shows you magkano yung na-contract out ng mga agencies. So ito yon, level na. May konting diferensya compared to what was actually released, which only means hindi lahat ng pondo nagamit. Tapos yung orange bar, yung disbursement, ito yung actual payment sa mga goods and service providers na kinontrata ng government agency. So again, makikita ninyo may difference between what was contracted out and what was actually paid. So sa susunod na slide, titingnan natin kung anong mga numero ito. So under Bayanihan 1, the total releases to the different government agencies was around 394 billion pesos. Itong column na to, yung unobligated funds, this represents yung hindi nagamit. So doon sa Bayanihan 1, merong 20 billion pesos na hindi nagamit ang iba-ibang government agencies. Ngayon, magkano naman yung hindi nabayaran ng government agencies doon sa kanilang mga goods and service providers as of June 30, kung kailan sinabi ng Kongreso, dapat hanggang doon lang yung spending na mangyayari for Bayanihan 1 and Bayanihan 2. So merong 11.9 billion pesos worth of obligations that were not paid. Sumunod yung Bayanihan 2, merong 214 billion pesos released sa iba-ibang government agencies again. Pero yun, makikita rin natin dito malaki na naman yung yung unused funds or yung unobligated funds. That's 14 billion pesos. Tapos yung unpaid obligations umabot pa sa 21 billion pesos. So kung titingnan natin yung health budget, yung isa sa may pinakamalaking portion doon sa nakita natin na 608 billion pesos na releases for both Bayanihan 1 and Bayanihan 2. So under Bayanihan 1, as of June 30, 2021, merong halos 49 billion pesos released to the DOH for different COVID-19 pandemic response programs, activities, and projects. Ang pinakamalaki dyan, yung na-transfer ng DOH doon sa PSDBM. Alam natin, so hindi ko na siguro kailangan i-discuss yung ongoing Senate Blue Ribbon Committee investigations tungkol doon sa Pharmaly. Yan. Kasama yan doon sa COVID-19 funds. Tapos meron din isa pa ditong yellow line, naka-highlight po silang dalawa kasi these represent funds that were not used. So kung i-sum up natin, 1.4 billion pesos of the 45.7 billion pesos of DOH funds were unused. And then ito, 2.1 billion pesos naman yung unpaid. So between Bayanihan 1 and Bayanihan 2, merong short period kung kailan nag-release din ang DBM ng additional funds for DOH. So the total of that is around 3.4 billion pesos. Pero if you look at this yellow row here, merong 2.6 billion pesos na isang loan assistance from the World Bank for COVID emergency response that DOH was again not able to use. So kalahati lang yung nagamit. 1.3 billion pesos of this 2.7 pala of the loan assistance from the World Bank was not used. And then meron pang ang nabayaran lang out of this 1.3 billion pesos is 45 million pesos. And then if you look at Bayanihan 2 naman, ang total po niyan ay halos 48 actually billion pesos. So, ito na naman, meron na namang 3.8 billion pesos para sa vaccines ito na hindi nagamit. Ang nagamit lang halos less than 500 million pesos. So there's actually 3.4 billion pesos that's still not used for the procurement of vaccines. Again, it's a loan assistance from the World Bank as well as ADB and AIIB. Pero sabi ng DOH noong Blue Ribbon Committee hearings, the funds can still be used even if nag-expire na daw yung Bayanihan 2. However, that's not the point. The point, of course, is accelerating vaccination. And how can we accelerate vaccination if we have funds but we do not procure them as fast as it should, as DOH should? And then there's also 2.6 billion pesos for lab testing services and hiring of additional personnel, specifically health frontliners that had 21.6 billion pesos, but 2.6 billion pesos of that remained unused. So kung isusuma natin yung Bayanihan 1, the short period between Bayanihan 1 and Bayanihan 2, you'll see that DOH actually received about 100 billion pesos from DBM, used up 90 billion pesos, but was not able to use 10 billion pesos, was not able to pay around 8.7 billion pesos. Ano yung basis nito? Yung basis ng figures na pinipresent ko ay hindi lang yung reports ng DBM, kundi pati na rin yung COA audit reports, which actually was the main reason why the Senate Blue Ribbon Committee started investigating on the COVID-19 funds. What else have we observed apart from underspending of the DOH? So generally, merong chronic underspending of frontline agencies. So even if I did not present the entire report of DBM, DepEd also had unspent funds amounting to about 4 billion pesos, and that could have been used to support distance learning. One other significant allocation under Bayanihan 2 was the budget for the PUV service contracting. Marami ng mga drivers yung nakikita natin nagmamalimos. They've been calling for ayuda, for aid. But even if there was a 4 billion peso budget in Bayanihan for service contracting para mabayaran sila sa kanilang pagbiyahe, ang nagamit lang doon ng LTFRB ay 101 million pesos. So the actual payouts na na-receive ng mga drivers ay 101 million pesos in total lang. And definitely, it did not, of course, LTFRB did not reach its minimum target to target beneficiaries for the PUV service contracting. And then in the COA audit report on DOH in particular, there were also some very significant observations like procedural lapses in fund utilization and procurement. I already mentioned the 42.4 billion funds transferred by DOH to the procurement service without proper documentation, and the Senate has actually been questioning this. I believe merong final na case sa Supreme Court regarding this. Sabi rin sa COA report, there were procedural lapses on the part of DOH in terms of procurement. Hindi naman, iba pa ito dun sa mga funds na na-transfer ng DOH sa procurement service. Merong mga lack of supporting documentation bukod pa dun sa kawalan ng Memorandum of Agreement for the 42.4 billion funds. And some disbursements or yung ibang paggamit ng pondo, walang legal basis according to COA. There are also other things. Pag tinignan naman natin yung procurement service, sila yung tumanggap ng 42.4 billion funds galing sa DOH. there were also some significant COA audit observations. For example, yung PS, hindi siya nag-submit sa COA resident auditor ng copies ng contract and purchase orders for their COVID-related funds. That's a requirement under COA. Yung sa COA circular, sinasabi niya, dapat ma-submit ng agency yung kopya ng contracts and purchase orders within 5 working days. But PS failed to do that. So out of 112 COVID-related contracts and purchase orders, 80 contracts yung na-receive ng resident COA auditor beyond the mandated time frame. Tapos, merong 32 contracts and purchase orders with a total amount of 8.85 billion that were not submitted at all to the resident auditor of COA. And curiously, this is around the same amount that we're talking about in terms of the amount of procurement sa Pharmaly. So yeah, there was lack of transparency at least on the side of PS, DBM. Sabi rin dun sa COA report, aside from not being able to submit to the COA resident auditors, PS also did not upload copies of those contracts and purchase orders in the GPPB online portal. The GPPB is the Government Procurement Policy Board, and they issued a resolution after Bayanihan 1 and 2 were passed that government agencies should upload copies of contracts and POs in the interest of transparency, of course. Hindi iyon ginawa ng PS para doon sa mga procurement na ginawa nila on behalf of DOH. But generally, there's also no systematic reporting of the total COVID-19 funds. Remember, we're talking about 608 billion pesos. Kanina sabi ko, it's not enough to know how much was released by the DBM to the different government agencies. What's more important for us to know is how did those departments and agencies use them? Walang report showing the breakdown of billions of funds versus the targets, because the targets were spelled out in Bayanihan 1 and 2. There's no breakdown, there's no reporting of how much was spent for those specific targets and what actually were accomplished. I think an exception can be made for the DSWD because there was an attempt on the part of DSWD to be transparent with the SAP disbursements. Meron silang online database, meron silang online dashboard kung saan nakikita yung status at ilan ang nakatanggap. But other than that, there's nothing online, there's nothing easily accessible for the general public to find out how exactly 608 billion pesos was spent. So yung makikita natin, generally, there's poor budget utilization of the COVID-19 funds that were released under Bayanihan 1 and 2. And that's true not only for DOH, but also other frontline government agencies who are supposed to fast track their implementation of programs and projects to be able to boost our pandemic response. But because nga merong poor budget utilization, isa siyang symptom ng bad governance. Kasi yung government agencies, hindi naman automatic yan na porque sinabi ng leadership ng IATF na you should do this, magta-translate agad to fast budget utilization or implementation. A lot of it depends on leadership. A lot of it depends on having a coherent strategy. So kung walang coherent strategy, what can we expect? So therefore, the consequence of bad governance is really a botched pandemic response. And so now, nearly 2 years into the pandemic, we still do not have enough testing. There's still no integrated contact tracing. We're unlikely to meet the self-imposed target of government to vaccinate 70 million Filipinos this year. We're only at 36% of that 70 million target, and it's already November. The public health system is basically breaking down if it hasn't already broken down. So natapos na yung Bayanihan 1 and Bayanihan 2. Meron pa rin 2021 budget. But as I mentioned a while ago, it's not designed for pandemic response and economic recovery. So now we have the proposed 2022 NEP. What can we expect? Is it really designed for recovery? So the 2022 proposed budget is actually 5 trillion pesos. If we look at the top 10 recipient departments, there's the DPWH, DepEd, DILG, DND, DSWD. Hindi kasama sa top 5 ang DOH. And even if the executive branch always says education receives the highest allocation because it's constitutionally mandated, yung allocation for education, that's basically computed as a sector. Pero kung titingnan lang natin by department, yung DepEd, mas mababa pa rin yung budget niya for DPWH. Pero kung isasama natin sa computation yung DepEd, SUCs, TESDA, and all the other higher educational institutions, mas mataas naman yung budget ng sector compared to DPWH. So as you can see here, what was proposed by the executive branch for the DOH is 157.5 billion pesos. But in total, the proposed sectoral budget for health is 242 billion pesos. So that's about 5% of the proposed 5 trillion national budget. That's equivalent to 4.8% of the proposed budget and 1.3% of the projected GDP for 2021. Maraming ibang health groups, kagaya nung Cure COVID Network, they're saying that 1.3% in the middle of the pandemic is really small and should be at least 10% of GDP. But yun nga, and unfortunately, this is how low it was when it was proposed by the executive branch. So JC already said a while ago that there's basically a need to address the public health crisis first. May consensus talaga dito yung mga economists, policy analysts around the world. But unfortunately, if we look at the 2022 proposed budget, the one that's prepared by the executive branch, it doesn't adequately support a more robust pandemic response. And why do we say that? It's because ito yung hitsura nung DOH, PhilHealth, and budgets ng specialty hospitals. So although there's a 17% increase in the total budget of the DOH at may 12% increase doon sa subsidy ng national government sa PhilHealth, yung specialty hospitals naman bumaba siya ng 17% in the middle of the pandemic. And remember, and I think many of the people in the audience work in the health sector, you know that these specialty hospitals are actually the COVID referral hospitals as well. So it kind of doesn't make sense to reduce the budgets for these hospitals in the middle of the pandemic, even if let's say mababa yung capacity nila to spend. So a total of in 2021, the specialty hospitals had a total of 5.6 billion subsidy from the national government. That went down by about 1 billion pesos doon sa executive proposed version ng budget. So nonetheless, if you look at the total budget of the sector, kasama yung PhilHealth, 2.12 billion pesos this year in the current 2021 budget, and it went up to 242 billion pesos. So merong net increase naman na 30 billion pesos. But is that enough? So although we see in the 2022 proposed budget that there are more funds for health facilities and human resources, there's less funds for family health and immunization, as well as epidemiology and surveillance. So those are the red rows that you see here. Yung 4.2 billion for that fund I mentioned kanina na hindi na spend, that's down to 102 million pesos in the NEP. I think this is the loan which is no longer available in the 2020 for 2022. And then yung family health, immunization, nutrition, and responsible parenting, as well as yung epidemiology and surveillance, which is definitely needed kung talagang gusto nating matapos yung pandemya. Bumaba pa ng 45 million, yung maliit na niya to begin with na budget. There's higher budgets for DOH hospitals as well, but there's decreased assistance for indigent patients. And in our consultations with poor households, such as members of the 4Ps program, sinasabi nila that this is one of the struggles of poor households, yung financial assistance kapag ka nagkasakit yung mga indigent patients, hindi lang dahil sa COVID, kundi yung pati na rin yung mga non-COVID illnesses, which of course becomes a huge financial burden for people who are already suffering financially and economically because of the pandemic. And then when we look at the funds for the booster shots, we'll see that it's parked under the unprogrammed appropriations. Ano yung unprogrammed appropriations? The unprogrammed appropriations is basically the part of the budget that's like an unfunded check. You cannot release it, you cannot use it unless any of these conditions are met. So the release of funds from the contingent fund is can only be triggered if there are excess revenues, if there are new revenues, halimbawa may bagong tax measures na in-impose yung government, or if there are approved loans for foreign assisted projects. Several senators raised, and even actually congressmen raised this concern about the vaccination fund since last year, doon sa 2021, when the 2021 budget was being deliberated on. But the DOF said this is nothing to be worried about because there are there are foreign loans that can finance this budget. But the thing here is that, of course, because it's not part of the program appropriations, or for example, hindi siya kasama sa budget ng DOH, it cannot readily be used unless DOF certifies and gives that certification to DBM that yes, there's already available cash, then DBM can release the funds to DOH or whichever government agency is now in charge of procuring the vaccines. But there's a valid question to be raised as to why the funds for booster shots will be funded by loans when the government has 3.2 trillion pesos target revenues. So why can the executive branch fund things like NTF, LCAP, and the Growth Equity Fund and financial support to local government units, which if you add all of the allocations for those would amount to about the same amount as the requirement for COVID vaccine booster shots, but not fund the vaccine booster shots with those revenues. So doon sa executive proposed budget, our assessment is that it really appears that the public health response is not a priority vis-a-vis other expenditures in the budget because yung vaccines nandun sa unprogrammed appropriations, yung initially walang funding for contact tracing either in the budget of DOH or DILG. Now, DOH said there was no funding for this because they were expecting Bayanihan 3 to be passed. Same with the allowances for the healthcare workers. So it's a wonder why DOH did not even include some allocation for it in the 2021 budget, even if actually hindi pa naman nasasubmit sa Congress yung proposed national expenditure plan nung finally sinabi ng Senate na it cannot pass Bayanihan 3 because there was no certificate of availability of funds. However, there were significant changes in the Senate version of the proposed 2022 budget. Although ito po ay based lang sa committee report ng Senate doon sa House version ng General Appropriations Bill. There are some positive developments, and these are really major attempts by the Senate to correct that misplaced prioritization and basically recalibrate the 2022 National Expenditure Program. So initially, merong 44 billion peso increase in the budget of DOH. That's a welcome development, definitely. And that includes funding for special risk allowances. Although it's not the entire funding requirement, they've determined it's 51 billion pesos. Parang 6.5 billion pesos lang yung nandoon under the budget of the DOH. And again, later I will discuss where the rest of it is lodged. There's also higher allocation now for epidemiology and surveillance. So masasabi natin, finally, the third year into the pandemic, magkakaroon ng 2 billion pesos from that measly allocation of 113 million pesos only in the executive proposed version. There's also higher budgets in the Senate version for the operations of public hospitals. So kasama din dito yung increases doon sa specialty hospitals. But one observation I made in that increase in the funding for public hospitals and the specialty hospitals is that the Senate just basically brought it back to the 2021 level. So there's really no real increase if you think about it. Parang kumbaga constant lang. Kung ano yung level ng 2021 and before 2021, konti lang yung in-increase niya compared to the executive proposed version. There are also higher budgets now for COVID-19 lab commodities. But we must take note that this funding is just MOOE or operating expenses lang. So definitely there is nothing in that line item for the establishment of new testing centers, even if the virus has actually spread in so many other regions in the country. This is just for buying COVID-19 lab commodities. There's also funds for the hiring of vaccinators. Finally, funds also lodged in the DILG budget, about 1 billion for the hiring of contact tracers. And then, yeah, as I mentioned a while ago, bumalik yung 1 billion peso budget that was slashed in the executive proposed version. And then in the sponsorship speech of Senator Angara on the budget, he also mentioned that the Senate filed a bill for COVID-19 benefits of frontliners. So that's Senate Bill 2421, which basically appropriates 51 billion pesos for benefits of health frontliners. It's not clear though how this will be sourced because 40 billion of that is parked under the unprogrammed appropriations. So again, we go back to the question, how will this be financed? Will it be through loans? Are they expecting new revenues? Are they expecting windfall revenues from GOCCs? We don't know. So even assuming the bill is passed and mag-appropriate ng 51 billion pesos for the benefits of health workers, the question still remains, how will DOF finance it? Is it going to be another situation where they cannot provide certificate of availability of funds and magiging unfunded mandate na naman ba siya katulad nung bayanihan? So we don't know yet. It's too early to tell because the fiscal year 2022 has not begun. Now, I focused mainly on the health budget, but in order to understand why we're saying that there are misguided priorities in the 2022 budget, we have to look at what other things are funded in the 2022 budget. So definitely, again, as in the 2021 budget, infrastructure continues to dominate the fiscal space, even if build is really not the most effective strategy for health and economic recovery. We're not saying infrastructure modernization is not needed. Of course, it is. But in the middle of the pandemic, should we be putting all our eggs in one basket and rely solely on build as our economic recovery strategy if on average DPWH and DOTR can only spend 40% of their budget? So ano yung magiging impact niya sa ating economy? And it's also not aligned with the prescription of many economists and policy thinkers around the world that we should provide direct aid and fiscal stimulus, like what JC discussed earlier, directly to individuals, directly to families, to households, and businesses na some of them closed down already, or some of them needs help in order to continue their operations. So the 2022 proposed budget, a large part of it went to DPWH and some of it went to DOTR. So the 2022 proposed budget of DOH slightly decreased, but it's still the top recipient department. And then the 2022 proposed budget of DOTR increased by 72% because of its railway program. And that is despite the fact that they are unable to spend. So what we see actually is an hindi uniform yung implementation ng technical parameters on evaluating the budget. Some agencies like the specialty hospitals, like DOH, like other departments like PSWD, DepEd, DOLE, they were basically penalized because they were not able to spend their budgets. And so nakat yung mga social services program. But that's not the case for DOTR. DOTR was also not able to spend a large chunk of its budget, but it got a 72% increase anyway. So there's definitely a problem there. And there's also the presence of non-urgent, I would call this non-urgent projects because marami ng local infrastructure projects na ini-implement yearly na nasa loob ng budget. Pero bakit meron pa rin ito? So although that local program decreased significantly because of the implementation of the Mandanas ruling, kasi binaba na yung implementation ng local infrastructure projects sa LGU. So ideally, hindi mo na ito dapat makikita kung kasama na pala ito doon sa national tax allotment. But what we saw is basically just a shift within the budget of the DPWH, whereby the cuts from the local program just went to convergence and special support program. And what are these? The funds that you see in the local infrastructure program have traditionally been the line item where the quote-unquote pork barrel funds are found. Yan yung mga initiated by legislators. These are multipurpose halls, small infrastructure projects, things like that. Of course, they are needed also, but should those types of infrastructure be the priority in the middle of an unprecedented health and socio-economic crisis? So basically, the convergence program of the DPWH just contained a rebranding of those pork projects because of the 2022 elections. If you check the General Appropriations Act for the local program, you'll see that these are basically the same projects, they just have a different program name in the 2022 budget. And then aside from that, there's also the presence of non-urgent expenditure items. Ito yung confidential funds and intelligence funds ng Presidente. There's also the contingent fund, which is at 13 billion pesos. And then you have again the NTF-ELCA, which is 28 billion pesos in the NEP version that went up from 16.4 billion pesos in this year's budget. And then aside from this 28 billion, there's also about 2 billion pesos in other government agencies for NTF-ELCA. 1 billion of that is in the PNP budget. And then other similar things for security na, yun nga, ito na naman yung priority. Here we go again with the skewed prioritization for security issues, even in the middle of the crisis. But again, there's some developments also with respect to this funding in the Senate approved version. So there were major cuts in the proposed budget of DPWH, DOTR, NTF, LCAC, and the other special purpose funds. So 32 billion pesos was slashed in the budget of DPWH. Although, as I mentioned a while ago, there's about 123 billion pesos for those patronage-driven projects. 2 billion pesos slashed from DOTR, even if they were actually unable to spend most of their funds. A very good development actually is the NTF LCAC was reduced from 28 billion to 4 billion pesos. And the special purpose funds, yung contingent fund, yung fund for pensions and other miscellaneous expenses of government, if you combine them, there's about 23.5 billion peso cut. Where did those funds go apart from health? They went to DSWD, DOLE, DTI, SUCs, although it's not as huge as what many sectors of society want to see in the budget. But at least there's standby fund for ayuda. There are some funds for social protection programs. There are some funds for emergency livelihood and employment, and even a fund as well for free COVID testing for job seekers. So all in all, what we see in the budgets from Bayanihan 1, the 2019 to 2021 budget utilization is that inefficient government spending is really a symptom of failure in governance. Budget cuts isn't the only problem we're facing that in particular the bureaucracy contends with. It's really the absorptive capacity of agencies. And if we do not do something about it, then the economic recovery, then pandemic response will really be in peril. So kanina, I mentioned the unspent and mismanaged funds of the DOH and the lack of coherent strategy. All of these things need to be addressed. So that's the governance aspect of all the public funds that I talked about. And without solving those things, we really cannot solve the public health crisis. And without solving the public health crisis, our economy also will have a hard time recovering. So the net version of the budget needs to be recast, and it needs to include many calls of civil society organizations for a more people-centered and pandemic-responsive budget. Fortunately, the Senate seems to be listening. At least there's really a major attempt to reallocate the 2022 NEP. And they tried to address those gaps, but a few other expenditure programs like those I mentioned a while ago, yung nasa convergence program ng DPWH, other funds that would go to support local government units, needs to be revisited so that the fiscal space can be maximized for economic aid and stimulus. So that ends my presentation. Pasensya na po if I went over time. I was trying to laymanize all of the figures that you see and the budget concepts and terminologies that were included in the presentation. Thank you, and we'll be happy to respond to additional questions if there are any in our Q&A portion. Salamat po.
Yeah, thank you, Zaiza. Please stay with us because we just have one more presentation and then we'll do the open forum. So let us now pass the floor to Dr. Jacqueline Monville. Dr. Jackie, please go ahead.
Good morning po sa lahat, and thank you so much to Philippine Center for Population and Development and Zelig Family Foundation for inviting me to this webinar. So while our two speakers was able to elucidate the picture of budget for health at the national level, allow me to share with you some of my experiences and insights. How's our budget for health at the ground level? So I'm Dr. Jacqueline Frances Monville, the current Provincial Health Officer of the Province of Agusan del Sur. So being invited into this forum, I must say I'm not an expert on the budget or on the processes of the budget. but it's as the provincial health officer, it's really important for me to learn the budgeting process, and even before the budgeting process, the planning process of the government. So looking into the different learnings we had in the budget for health, I came across this quote: "Don't tell me what you value, show me your budget, and I'll tell you what you value." So, as the provincial health officer of Agusan del Sur, I really had to learn the budget process. So, allow me to share with you the four phases of Philippine budget process vis-a-vis my experience as the PHO of a province. So, there are four phases: the budget preparation, the budget legislation, the budget execution, and the accountability of the budget that we are using, because these are money of the people, of the Filipino people. So based on my experience in the budget preparation at the province level, it's really important that our budget is anchored to a goal. Meron po tayong foresight kung ano po yung gusto nating mangyari. Hence, ito yung ating budget. So the budget must be focused on achieving goals. Goals that are specific, measurable, achievable, relevant, and time-bound. When I say specific, it changes lives. When I say measurable, it helps to improve the lives of the people. Achievable, it can be achieved, it is relevant to the people, and it has limits as to time. It also contributes to a bigger and larger goal. In essence, we take care of the trees, but while looking at the big picture of the forest. We take care of every person, but we look at where is the goal of this certain government going in terms of improving communities. Second, it is important that it is evidence-based budgeting. Number one, when we say evidence-based budgeting, it is the felt need of the people. And we must do away with what we think is best for the people, because the people know what's best for them. So very important that we sense and we ask them what they need. Second, in terms of health, it is measured by health outcomes. So when we put budget in improving maternal health care, we make sure that mothers do not die when they give birth. Third, we need to evaluate our performance previously so that we can move forward what needs to be improved in us. Third, it must be incorporated into the plan. Sometimes the local governments are actually drowning with a lot of plans, right? So we have a 10-year plan, a 6-year plan, Philippine Development Plan. We have a 3-year plan based on the mandate of DILG, the Executive Legislative Agenda, and in terms of the Department of Health, the Local Investment Plan for Health, and the 1-year plan. The 1-year plan is the annual investment plan, and side by side with the annual operation plan for health as mandated by the Department of Health. Another point is we need to be savvy in identifying budget sources, both internal and external. And our plan must be inclusive. It covers the different suggestions, ideas from all grounds, people on the ground, and also us looking at the ground. Second, it must be grounded, no, our plan. Hindi po siya hinugot lang kasi basta ma-spend na lang yung budget. It must be grounded. It must be participative. It must be responsive, and it must be visionary. So the next phase is the budget legislation. So I'll share with you my experience as to budget legislation. Number one, our plans must be presented and endorsed by the Provincial Health Board, which I must say, as a province, we still need to improve on this, no? Because when I arrived, I still needed to establish a strong provincial health board who appreciate their roles and their participation in that board. Second, the plans must be presented to the Provincial Development Council, the Social Sector Council, And then third is Provincial Development Council. So in our province, our previous governor and our current governor really made sure that the sectors are established. So we have different sectors to include the social sector, the economic sector, the public safety sector, and the transforming bureaucracy sector. And all plans of such sectors will be reviewed and scrutinized by the Provincial Development Council, composed of members coming from the public and private sector. And this must be approved by the governor and endorsed to the Sangguniang Panlalawigan for the budget to be authorized by the Sangguniang Panlalawigan for it to be operationalized and submitted to the Department of Budget and Management. So side by side with the legislation of the budget for the coming year, we need to execute the budget. So for the execution of the budget, it's really important that as the Provincial Health Office, we need to request for budget release. Only when you request for a budget release, your budget will be released. And we have to be very resilient and pathfinders as we go through the procurement system and processes. Really, this is a big stumbling block in the health sector because sometimes matatapos na yung taon pero yung bidding process hindi pa natatapos so hindi ma-release so I must say we still need to improve on this and we need to strategize how to facilitate and make sure that the public health commodities can be released on time. And we need to evaluate ourselves based on budget utilization, and very important that we liquidate properly. So the fourth phase is accountability. It's really important that in the accountability for our budget, we need to be efficient and judicious on spending. We order our budget because there is a goal and outcome to be improved in the lives of people. Accountability also that we improve our health systems to allow people to navigate the health system with ease and efficiency and effectivity into their lives. And goal is the accountable of the budget is we improve health outcomes, better health outcomes. So as a provincial health officer, how do I plan? I have this framework in mind that the health system has 6 building blocks of health, which we consider. So it's really important that in the 6 building blocks of health, this is the health system function. This can be moved to a health system performance so that we can impact the lives of people. So for the health system function, it's really important that leadership and governance is number 1, political will, because political will dictate how we finance health, and how we support the health workforce, the health information system, and what we buy, the medical products, vaccines, and technologies, so that we can produce a service delivery that is accessible, covers our people, efficient, equitable, quality, safe, and sustainable. And our impact must be responsive also to the needs of the people. We protect them from risk of out-of-pocket expenditure, and we improve their health. And we improve in the larger scale the communities and lives of the people. So in the case of Agusan del Sur, our primary goal is to reduce poverty incidence. So everything that we do in the provincial government is anchored in reducing the poverty incidence. So our role in the provincial health office is to prevent people from out-of-pocket expenditure and to improve health outcomes. So yun po yung contribution namin sa sinasabi kong bigger picture and goal. So our province is a first-class province, and for 2020, we have 785,384 million budget. So kung makikita nyo, this is 30.92% of our total budget. So bakit nagkaganito? Because during the pandemic, there is a mandate from our leader, our governor, to realign the budget. So everyone was schooled what budget they could give up in order to prevent and to respond to the pandemic. So our province, by the way, has 13 municipalities and one city, and almost 50% of its barangay are considered geographically isolated in disadvantaged area. So we have 7 government hospitals, 235 beds only. So this is really lacking because with our population of around 700,000, we need one hospital bed is to 1,000 population based on standards. So sobrang ano pa kami, we still lack hospital beds. We have our private hospitals, but since majority of the people are poor, they will really depend on the government hospital. So in terms of our population, around 37% are indigenous people, and we also ensure that we improve the lives of the people one household at a time. And in terms of health, you know, side by side with we were discussing devolution transition plan, first came the universal health care. So in terms of the universal health care, our goal really is, kami ng aking governor, is a quality healthcare system with healthy, empowered, and happy Southern Agusanons. So in order to achieve this goal for health, the municipalities and the efforts of the province must meet in order for us to have a continuity of care of our patient. And this is reflected in our local investment plan for health, our health facility accreditation, our health information system, and also, since timely for the pandemic, a resilience-oriented health system. And we have enough human resource, no? And of course, we don't forget to address the social determinants of health. So I would like to thank Zwillig Family Foundation to actually guide our perspective and how we look at health, no? On how we look the funding of how we view health as a whole. So credits to Zwillig Family Foundation. So pag sinabi natin yung health system works this way, it must be anchored in better health outcomes, no? So we also see that our budget is aligned. What health outcome are we funding, and what health outcome is needed by the people? So experience, no, and insights from a pandemic. This pandemic really stretched us to our limits. It break us and it tested us. And we had a health system overload and breakdown. Marami na po kaming experience. And yung breakdown namin, pataas ng pataas yung limits, no? Kung dati, ito lang yung surge na kayangan namin, yung next surge is higher and more complicated and more difficult than the previous surge, no? So the recent surge talaga yung pinaka most difficult, and it really na-breakdown talaga dyan yung health system namin because we needed to close down admissions in the hospitals. But ang pinaka-challenging dyan is hindi lang yung breakdown ng health system, but also breakdown ng mga relationship among health workers, no? And even mga frontliners, because we cannot take up so many complicated cases of COVID. Nagkaroon ng misunderstanding, no? But we have to explain and we have to bridge people and unite people towards a common cause. And thank you, na-survive namin yung pinaka-surge sa previous. But we are readying for another surge come December. So this pandemic also exposed our weakness, that we literally scrambled for a steep learning and action curve in order to catch up fast to save our people, literally. So the previous surge, nagkakaroon kami ng daily deaths na parang magbibilang talaga kami 10, 5, 10, no, daily po yun, na sobrang steep yung curve ng pag-increase ng deaths. And these days, bilang na lang yung deaths, no? 1 in a week, ganun na lang. But we are still not, di pa rin kami mag-fence-eaters. We don't want to be fence-eaters because we are preparing for a bigger surge. So this united us towards a common goal of defeating COVID-19 with the leadership of our governor and in strong tandem with me. So ako nakita ko dito sa experience ko na really important that the executive leader listens to the provincial health officer. And in fairness to my governor and thanks to him, he really listens, no? And he would say na we will move with the advice of our provincial health office. But grabe talaga yung paglabi niya sa aming provincial interagency task force and provincial health board, no? So it's really important that these two bodies are functional and active, and we have a strong support from the top management. This top management are the different heads of the department that are willing to give away their budget in order to have a strong pandemic response. So at this time of the pandemic, a lot of budget were realigned to pandemic response. And in relation of the realignment, we dedicated these funds for a strict health protocol for tracing, testing, treat, and recover. So in terms of testing, although our province is still part of the top 20 poorest province of the Philippines, but we are like number 3 last 2009, and we are number 16 now. And our goal is to go out of that prestigious knowledge or to the country that we are in the top 20. So I must say that although we are in the top 20 poorest province, I am proud that we have erected a molecular laboratory with the effort of our leaders, of our elected leaders. They talk to the private sector and hand in hand, they put a budget to erect a molecular lab. That's why testing is not a problem in our province, as mentioned by the previous speakers, because we do mass testing. And we ensure that as much as possible, hindi po magbayad yung taong bayan, because if you pay for the testing of around almost 3,000, how would you wanted to be tested? Ayaw mo na lang magpa-test kasi mahal yan eh. So we made sure that our testing is for free for those who needs to be tested. So important po yan. And actually, our molecular lab is the most performing molecular lab across Caraga region, no? So in-expand pa mo namin yung horizon namin na we test not only Agusan del Sur but even beyond. But this cost us a lot of budget, no? But thanks to our regional office who's really helping us, DOH regional office, to secure testing kits. So na-secure namin yung treat. Yung treat namin, we scrambled for medicines for COVID and oxygen, no? So thanks to our leaders again, although our leaders in Congress, hindi naman sila nasa executive, pero nag-fundraising talaga sila to ensure that we have enough medicines and oxygen in our hospitals. And we gave even other equipment, no, and vehicle to the municipalities. So in terms of the Bayanihan funds, itong Bayanihan funds, we made sure that we shared it to the municipalities by also securing their isolation facilities and their transport system and even medical supplies and medicines and testing. So yun po yung ginawa namin. And recover, no? Nagmi-meeting din po ang aming agricultural side, DTI, Provincial Social Welfare Development Office, kung paano tutulungan ang taong bayan to recover. So yun po yung experience and insights namin from the pandemic. So pumasok po ang Presidential EO number 138, which is the full devolution of certain functions to the LGU. This is quite challenging then, but I think this is an opportunity for the health sector to identify our needs. So for the devolved functions, we have human resource for health, health facility enhancement program, and learnings from the pandemic, we need to strengthen our epidemiology and surveillance and to secure our public health commodities. So, sometimes ang challenge po sa ating governance is yung pagbaba ng mga forms na hindi naintindihan ng local government. So may mga forms na bababa pero hindi na-explain. So what we did in our province is to really sit down and understood these forms. So I think a good devolution transition plan, number one, we have to assess ourselves in terms of the inventory of the LGU functions that we have right now, the services and facilities, vis-a-vis what is expected from us. Second, we have to have a strong capacity development assessment and agenda for our health workers. And third, we need to focus in improving the organizational structure of the provincial health office. In the provincial perspective, it's really important that we have a strong provincial health office in order to have a strong oversight of a strong provincial health system. So side by side is we have to identify the critical positions to be added to the already existing provincial health office. When I say critical, hindi po siya balong malalim na order lang ng positions, but more of identifying what is the critical positions to be added in order for us to function to function in relation to the expectations of number one, the national government, but most importantly, function as to the expectations of the people. So yun po yun. And of course, dahil may accountability tayo dito sa sinasabi nating devolution, it's really important for us to identify in what aspects of our performance can we be monitored, hence our performance monitoring framework. So, given the devolution, ang ginagol po talaga namin is not just a good provincial health system, but given the realization and the learnings from the pandemic, we need to build a resilient provincial health system. We need to build our nation province by province, region by region, Luzon, Visayas, Mindanao. Kung ako lang po yung na the national government must look at how are the provinces. We have 88 provinces, and kung may improve natin province to province, and this province infects the neighboring province to improve, and we improve region to region, I believe ito po ang mga essentials to a resilient provincial health system. Number one, a strong political and top management support. Ibig sabihin, hindi lang po ang local chief executive yung strong, even the top management, because how can the local chief executive execute if the top management is not strong? So side by side, dapat malakas po yung local chief executive with the top management and supportive to health. No? Second, we are united towards a common vision and goal. So in the case of our province, very clear to us that our goal is poverty incidence. And this vision and goal is communicated across the bureaucracy and going to every community, purok, and household. Third, we have to have a committed and competent health workers. When I say committed, it's really important na sa puso po ng bawat health worker yung public service, no? But I must say na important po ito, no, na nagsisimula ito sa I hope every university will train health workers to be committed and have the heart for public health service. Kasi minsan challenging po. In my experience as a doctor, it's really important that as doctors, we are trained, that we become doctors to heal the people. Because when we say that we become doctors because it's a lucrative, profession, I think we are in the wrong profession, because as doctors, we don't make money out of the misery of the people. Yan po yung tinandaan ko from my professor from med school, no? Sir Butching Paterno. Siya po yung nagturo sa amin noon na we don't make money out of the misery of other people. So very clear po sa health workers dapat yun. And competent na health workers. When I say competent, hindi lang po namin nalalaman paano mag-treat ng pasyente, pero nalalaman namin paano ang proseso ng gobyerno so that we can lobby for budget and health reforms. Fourth is empowered city, municipality, and barangay. When we say empowered is alam din po nila mag-demand ng mga rights nila to health, no? And fifth is informed and empowered communities. When I say informed, I think malayo pa po yung lalakbayin ng ating bansa in terms of health education and promotion, and how we ensure that people are informed about their rights to health and what they could access in health. And sixth, we need to invest in the public health programs. I'm not sure if our national government reviewed, but from my perspective, I can see that we have big allocation for hospitals, but I think the public health sector is crying and begging, I think, for more budget, no? Kung personally kasi when I arrived, 3 years pa lang po ako na PHO in the province of Agusan del Sur. And when I arrived in the province and reviewed the budget is really skewed significantly to hospital services. So in my leadership, I made sure na balance po yung investment, no? Na mag-invest din po tayo sa public health programs, because nakarating ang isang pasyente sa hospital because maybe hindi niya na-access yung health doon sa kung nasaan siya nakatira, no? And I think lastly is it's really important that we address the social determinants of health. So, ang battle cry lang namin na kanina nakita niyo na yung vision namin sa health, medyo nagdagdag lang po kami, no, ng resilient. So, as a province, it's really, ito po yung aming vision, no? Hand in hand with our goal. So our vision is a quality and resilient healthcare system with healthy, empowered, and happy Southern Agusanons towards our goal of decreasing poverty reduction in our province and hoping that we go out of the top 20 poorest province in the Philippines. So yan lang po yung aking maibabahagi, and maraming salamat.
Thank you very much, Dr. Jackie, for that presentation and the sharing. So, Dr. Marilyn, so we've
Yes,
heard from our three speakers po, no? Si JC, who laid down yung economic context of the national budget and how prioritizing the health budget is key to our economic recovery. Tapos si Zaiza naman presented the key features of the proposed 22 health budget along with yung experience doon sa 2021 and partly the 2019 budgets including Bayanihan 1 and 2. And then of course si Doc Jackie shared her experiences and insights in the budget processes as it relates to health service provision, pandemic response, and in fact down to yung magiging effect ng full devolution of certain public functions because of the Mandanas and Brasilia. So I guess we're now opening the floor, Doctora, to questions.
Yes, but I just want to say that I want to I want to really say that JC's and Zaisa's presentation and Dr. Monville, they are very revealing. I actually had this gut reaction. Although I've been watching the Senate Blue Ribbon Committee, I've been reading about the growth of our economy, or the lapses in it. But it was made more clear to me by JC's and by Zaisa's presentations. Actually, it was a gut reaction also because I felt angry and outraged. And I have plenty of questions like, JC kept saying that government is not spending as much, it's crimped, and that there's crimping at a time like this. And then Zaisa's point about the non-prioritization of the health budget, you know, and imagine booster vaccines in the unappropriated programs. For me, these are questions. This is really the height for me of well, it's hard to judge, but from the way I see it and from what I've been reading and listening to the Blue Ribbon Committee, yes, I could easily say, yeah, this is really the height of what I call incompetence, and it's not only incompetence, but it's more more telling, you know, that word keeps on coming back to me. What's happening with this at the height of the pandemic, at this time when people are dying, health workers are actually being exposed. It really makes me mad. Anyway, so shall we start the questions now?
Yeah, siguro, Doktora, when offhand ako, I was trying to find the words as to ano yung nararamdaman ko kanila. Maybe just like with you. Sinulat ko pa nga, in fact, it's really disheartening.
You also felt
It's
angry.
saddening.
Yeah.
Well, yeah, it's disappointing and depressing. But yeah, I guess the correct word siguro is really, magagalit ka. But siguro, yeah, let me siguro, Doctor, while waiting for our participants to ask questions, so open po yung Q&A box for questions or comments or suggestions. But while waiting for them, for you, siguro nga po, Doctor,
Yeah,
let me
I would like to,
ask the first,
if
the
while
first
waiting for
question.
them, may I just ask, JC, could you just please tell me what is the reason behind government's not spending at this time?
That's a
Why?
question as well, Marilen, that I keep asking myself. But I think this is really rooted in the philosophy or the economic plan of the economic managers of President Duterte. As headed, as you know, by Secretary Dominguez of the Department of Finance, as well as Secretary Chua of NEDA. They think that we should prioritize the or manage the debt levels of the Philippines. I think that's one of their main concerns. And true enough, as I mentioned, the debt to GDP ratio of the Philippines has increased to 60%,
Right.
whereas a few years back it was just around 45, 49%. So there has been a considerable increase in the debt to GDP ratio as the government has found it quite difficult to finance its COVID response with meager tax revenue, so it has had to borrow from international sources. But as I mentioned, actually, the big part of that comes from Filipinos themselves, from the domestic credit markets. So in a way, many Filipinos have funds that they can spare, and they find that it's quite safe to invest in government securities. And in that way, they help finance the pandemic response of government. But in fact, Marilyn, many international economists have warned governments against scrimping too much at this time. And in fact, they have been saying quite consistently, imagine even the IMF has been, which before has been advocating for austerity measures in the past. They are now encouraging governments to spend quite liberally in their pandemic responses, recognizing that this can accelerate the economic recovery. And for example, if you spend on ayuda, economic aid for the poor, that in itself can stimulate spending
Right.
and boost the
Right.
economy's recovery. So it's a
Right.
win-win for the economy. But unfortunately, even though many economists have pointed this out to the economic managers, they're not listening. So I myself have given up, and I'm just waiting for the next government to have their priorities straight.
And they're not spending on the wrong things. They're just scrimping.
Well, that's the thing. They are scrimping, and at the same time, the significant sums that they have, to the extent that they have such funds, they're scrimping on the wrong things. For example, we know about the Farmally, we know about the build, which is
Yeah.
not remotely related to the pandemic response. So it's double whammy. They're scrimping,
Yeah.
and the money that they have, they're not spending it quite
Yeah.
well.
And that's why your report came out to me like, wow. So this is what we are in now. And with a 10-year recovery ahead of us, wow, that's really something to look forward to. That's why, I'm really hoping that the May 2022 elections will change everything. Leadership talaga counts.
Yes. I'm holding out hope as well, Marilyn. I think that's the key to the
Yes.
economy's recovery. We
Yes.
should choose the next leaders wisely.
Yes, me too. Thank
Yeah.
you. Thank you, JC. Tony Boy.
Yeah, well, let me ask you a question siguro kay Zaiza. No? Zaiza, kasi you mentioned there's a lot of unspent budget for health. And I think this really boils down to, well, of course, you mentioned really governance and absorptive capacity of the government. Is there an acceptable level of how do we call that, acceptable level for non-utilization of funds? I mean in government. Sabi nga kanina ng JC, di ba dati gusto natin magtipid, pero may ganyan bang level?
Actually, the standard is to save funds. Government is supposed to spend. Dapat walang natitira. If it is going to save at all, it is supposed to come from efficiency measures lang. Like for example, they bid out a project, and then a certain bidder offer the contract price that's lower than what the intended budget for it is, then yes, that's good. But the kind of non-utilization of budget that's due to the inability to spend and absorptive capacity problems, that's not totally unacceptable, because what that means is programs and projects that are supposed to benefit target populations do not get the public good and services that those funds are intended for. So lagi namin sinasabi ni JC sa mga talks, yung principle ng government fund utilization is very different from a household. Households need to save up for emergencies in the future, ganyan, contingencies. Yung government baliktad. Kasi if the government doesn't spend, they're basically denying ordinary citizens of public goods and services that are anyway funded by taxpayers' money, whether that's the program appropriations I was talking about or the portion of the budget that comes from borrowings. Kasi in the end, it's the taxpayers' money that's going to pay for the borrowing. So dapat naman maramdaman naman ng taxpayers yung spending ng government. So walang unacceptable level. Dapat 100%
That's what I wanted to hear. Kasi nga, baka mamaya iniisip ng iba, it's just pinito that's savings and etc. Pero hindi eh. They should have really been delivered services, goods to the public. Yeah. Dr. Marilyn?
Yes, I was thinking also about the Bayanihan 3 that was not passed, and then the status of implementation of the Mandanas Garcia ruling, and how this affects the LGUs, and with the current budget that we have. Well, not yet passed, right? But still, it is going to be. So what do you think? Because Bayanihan 3 has been, it has not passed, and then the Mandanas ruling, I don't know, has it really been implemented yet? So how will this affect the LGUs in terms of health? Or since the LGUs have their own sources naman of income and their own IRA and all that, do you think this will affect them to a certain extent? Could you please talk more about that, Saisa?
Yes, okay. So Bayanihan 3 was not passed, so definitely there's no funding for ayuda that was supposed to provide aid to households and individuals who were affected by the pandemic since 2020. Although I said there's ayuda proposed in the Senate version of the budget, that's intended as a future allocation, as a standby allocation in case there's a lockdown in the future. So the question now, anong mangyayari dun sa mga tao na facing economic misery? JC nga pointed out, 4 million people do not have jobs.
Right.
There's food inflation. So how are we going to get our people out of misery?
Yeah.
We've done a lot of consultation with 4 Ps members, and they said yung effect kasi talaga ng pandemic sa kanila mahaba eh. Nahihirapan na sila matagal. I mean, if you recall the community pantries, talagang pumila yung mga tao doon. And that just goes to show that people are actually hungry. People cannot afford to buy their basic necessities. I mean, swerte yung mga hindi nawala ng trabaho. But at some point, if I remember right, JC, di ba halos 10 million ba yung yung unemployed because of the lockdown?
Yes,
Parang ganun, no?
yeah. If you add yung mga unemployed and underemployed. Yes.
Yes, tas hindi pa natin pinag-uusapan yung underemployed who do not make who do not have incomes now, na wala talaga completely yung sources of livelihood. So talagang mahirap para sa kanila. So the question now is, what is the government doing to help them? Kung ang pinag-uusapan lang natin na ayuda, yung para sa future lockdowns, hindi naman natapos yung misery ng mga tao after the lockdowns were lifted. So maraming tao pa rin yung nahihirapan. And then, with respect to the Mandanas ruling, of course, at the current level of income and era, or the support that LGUs get from the national governments, they cannot afford to provide ayuda for all of for their local constituency. Kasi like for example, I'm currently in Puerto Galera. It's a tourist spot, and many people here, tourism workers lost jobs, and I got to talk to a few of them. Talagang no income at all since the lockdown last year. So hindi naman rin kakayanin ng local governments to support those sectors. And yun na, those in the service sector, in tourism sector, just among a few of them. So ano yung plano? But the Mandanas ruling will be implemented next year, and it's expected, of course, that local government units will receive higher NTA, or the national tax allotment that used to be called IRA, because of it. Kaya lang the question rin is, we're in the middle of an unprecedented economic crisis. Tapos, merong mga iba pang subsidies yung national government for the local government units. But why is it all local infrastructure? Who's going to benefit from infrastructure project? It's the politicos, it's the local elite, yung mga engineers, yung mga construction firms in these localities.
Right.
I mean, even if it employs people, the fact of the matter is, it's not all construction workers who were affected by the pandemic. Parang can tourism workers, like tourist guides, like dive instructors, do construction work? Can the waitresses and yung mga masahista do construction work? Kaya yun yung question. If the economic managers keep saying they need to be fiscally prudent, I don't think it's fiscal prudence to keep allocating funds for things that do not directly benefit people who were severely affected by the pandemic. So yun yung question. And I with respect naman to health financing, I think even if the Mandanas ruling sets aside more funds for local government units, technical capacity, as Doc Jackie mentioned kanina, it's really difficult. Hindi madali yung putting up a hospital, and more so thinking about the organizational structure of those hospitals. Who's going to do that? Who's going to help the local government units? Because traditionally, the expertise to determine yung mga organizational structure and compensation, DBM yan eh. It's an entire bureau in DBM. So mahirap siya. I multiply that by how many thousands of LGUs. I'm not sure how that can be done, and how UHC can be successful without DOH and the national government still stepping in, at least in terms of oversight and technical assistance to local government units.
Thank you, Sai. So, can I ask you one more question, please? What is naman the wisdom behind slashing the specialty hospitals, the COVID centers, like especially Lung Center, the Philippine Children's Medical Center? What is the wisdom behind that?
I think candidly, it was left to the technocrats in government to decide on those little things. Syempre, iba yung iba yung work ng technocrats in terms of analyzing the financial side of the budget, just the number. Syempre, they will look at they will consider parameters like capacity to spend, how much pa yung balances, can they actually implement the programs. They will look at things like that. But that's the thing. That's why there's the DBCC. That's why there are economic managers. It's in order to put into context yung technical evaluation na nangyayari. So, ang solution ba for the pandemic is to penalize specialty hospitals who cannot spend even if they have to take in a lot of patients. Why can't they enable and capacitate those specialty hospitals instead of taking out funds? Kasi pwede namang, sige, at the very least, at least keep it at the level that it's at in the 2021 budget, but at least add some for hiring ng health workers. It doesn't necessarily have to be lahat plantilla positions, kasi kung talagang plantilla positions yung aasahan natin, mga baka 10 years tayo maka-fill up ng positions. But kailangan ng kailangan ng mga emergency measures. Parang the bureaucracy cannot operate in the same way that it operates pre-pandemic. Kasi this is a crisis. So dapat yung response, may sense of urgency, dapat innovative, dapat they think outside of the box. So hindi pa pwede yung business as usual way of looking at the budget. And one other thing, I mentioned kanina na even if that's applied to the specialty hospitals, it doesn't apply to the infrastructure agencies like DPWH and DOTR. So bakit ganon? So in that case, you see that politics, that budget priorities of the economic managers, because it is coming from syempre the president himself and some legislators stand to benefit from it. It trumps the technical parameters of assessing the budget. So makikita mo yung ganun ka-disjointed yung decision making around the budget priorities in both 2021 and actually 2022. But at least may attempt naman to correct it.
Yeah. Okay, thank you so much, Saisa. Tony Boy?
Yeah, siguro as a segue din, and going back dun sa binanggit mo, Doktora, on the Mandanas ruling, let me ask siguro si Doktora Jackie, as far as their preparations at the local level, in terms of ensuring that the health sector gets a fair share of the pie. Kasi, di ba, yung Mandanas ruling, ibibigay sa local government units yung increased NTA, pero bahala si local government unit naman ngayon dyan doon sa mga devolved services of not just health, but also of other agencies. So how do we ensure that the sector gets, hindi ko nga sabing higher, but a fair share of that pie? So Doc Jackie?
Thank you for that question, Doc Tony. So how do we ensure? I think it's really important that we have a local investment plan for health, wherein the other municipalities and our one city that we have here also put their request, and also the provincial health office, we have a plan. So what we do is we really need to communicate to our governor and the top management our priorities, so that when time comes, they know how they could assist us to ensure the budget. So for me, actually, maybe I'm lucky to be here because our governor and our top management is supportive in terms of health. So we make sure that we communicate our needs, and we also incorporated this to our devolution transition plan. So during the talks and discussion on the devolution transition plan, it was clear to the top management and even our governor that we need to invest. For the first three phases, we need to invest in improving the provincial health office and our investment for the public health programs. Because through the years, they have seen that we still lack on that aspect. And side by side is to ensure that those positions, plantilla positions that are unfunded in the current level capacity of our hospitals will be funded so that we can complete it and ensure that our hospital workers are not overstretched. So yun po yung first 3 years plan ng aming devolution in terms of health. And maybe in the next 3 years, we could already expand our hospitals. And we are on the talks of also exploring if we could have one of our hospitals to be under DOH. But it's still on the works because we have many things to assess. So I think that's it po, Dr. Tony, for the part of health sa Agusan del Sur.
Yeah, thank you. Maybe Dr. Marilen, as a follow-up, and this is a follow-up to our other speakers, maybe JC or Zaiza could weigh in. Syempre, din-involve na itong service, itong pondong ito. Pero ang sabi ng mga ibang local government units is sa ngayon pa nga lang, kulang na yung pondo nila sa kanilang pagbibigay serbisyo. So ang in-expect na dagdag yun doon. Pero ang ginawa ng national government ay dinagdagan din yung dinivolve na serbisyong i-implement ng mga local government units. So, what's your take here?
Yung sa akin, Dr. Tony Boy, isa din sa mga important aspects nito ay yung Mandanas ruling, of course, represents a windfall supposedly dun sa mga LGUs. Malaking pera ang matatanggap nila. Pero, at ang nakalagay doon sa decision ay they're entitled to a larger share of the revenues from the national government. Pero yung revenues na yun ay porsyento ng income ng ating ekonomiya. Kung lugmok pa rin yung ekonomiya natin dahil nga palpak yung pandemic response, sunod-sunod yung mga lockdowns, hindi ganun kalaki yung revenues na makukuha ng national government and hindi rin ganun kalaki yung windfall na makukuha ng mga LGUs mula doon sa Mandanas ruling. So tama ka na aside from the more yung greater functions dahil sa devolution which will eat away at their fiscal resources ay yung expectation nila ng windfall from Mandanas should also be muted dahil dun sa patuloy na economic crisis natin. So this ties neatly doon sa pangangailangan pa rin ng isang comprehensive evidence-based national pandemic response. So nakatali lahat yun dun sa ano ba yung direction na tinatahak ng national government, and that will dictate the pace of the economy's recovery as well as the windfalls from Mandanas.
So JC, tama ba ako na siguro tama na next year or 2022 and 2023 medyo mataas yung makukuha nila, pero come 2024, 25, 26 hindi ganyan, tama ba?
Well, of course, it depends dun sa rate ng recovery natin. Nakita natin na somehow medyo mas bumabalik ng sigla ng ekonomiya as the economy opens up. 7.1% GDP growth in the third quarter. Pero of course, nandiyan pa rin yung threats kasi ng bagong variants, ng new outbreaks. Pero kung wala pa rin sapat na testing, contact tracing, and treatment, bumalik ulit yung mga lockdowns and all of that in the coming months. So who's to know kung tapos na ba talaga yung lockdowns o meron pa palang susunod na episode. So by no means is the economy's recovery still solid. It's still on shaky ground. So kailangan pa rin yung ganong klaseng tutok na direction mula sa national government.
Yeah, because these lockdowns, new variant, high positivity rate. Tapos, like what you said, JC, yung cycle, hindi na break eh. Every time there's a new surge, okay, lockdowns. That's the only response I've seen so far. So,
Doc Tony and Doc Marilyn, if I may add po dun sa sinabi ni JC about the
Yes.
expected revenue.
yes.
Actually, DOF already tempered the expectation of local government units. So after 2020, talagang mas mababa yung marireceive nila na share from national revenues kasi 'di ba it's computed, I forgot how many years back, kung 2 ba or 3, yung 2-3 years back ang base year. So dahil nga dun sa pandemic, so lower yung revenue, so lower din yung magiging share ng LGUs. But I kind of want to put it also in perspective, both sa side ng LGUs at saka sa side ng national. Definitely, it's a lot of burden talaga for the local government units kasi nga ang daming din-involved na functions like local infra, tapos local infra pa lang, di ba? Ang dami ng demand doon. Health, which is a bigger responsibility now because of the UHC law. Ang laki ng burden din na pinasa sa provincial health, provincial LGUs lalong-lalo na. And then many other sectors. But on the national government side, the reason why it had to devolve a lot of functions kasi sa 2022, ang additional kasi dun sa previously called na era ay 265 billion pesos. So, malaking amount yon taken out from the national government talaga. But I'd like to point out na challenge kasi yung allocation ng fiscal space sa national government because of two populist measures the past few years. The first one is the free tuition. I know this might be an unpopular opinion, but if I remember correctly, yung mandated lang yata sa Constitution ay basic education ba? Hindi naman kasama yung tertiary education. So it was entirely a decision of the executive branch to fund. And kung matatandaan natin, kasabay nung pag-implement kasi nung free tuition yung train. So kahit na sinasabi nilang yung train yung magfa-fund ng build, the reality is because free tuition law was implemented, it ate up the national government's fiscal space. Originally, sabi nila dun sa free tuition, parang ang estimate yata ng CHED, about 100 billion. Pero yun, because they can't spend it rin naman readily, binabaan yun. So naging 50 billion hanggang sa naging 40, 30. But the fact of the matter is, it's a recurring expense for national government. So that's 30 to 30, somewhere between 30 to 50 billion every year. Second big challenge in terms of fiscal sustainability is raising the base pay of the police and the military. This is the bigger expense compared to free tuition. Nung unang implementation kasi dinoble yung salaries ng police and ng military. So that not only distorted the salary standardization of government, but that also meant additional yearly expense for the government na hindi talaga siya fiscally sustainable. Sabi kasi dun sa joint resolution, so ida-double yung base pay, meaning yung basic pay, hindi yung benefits ng police at ng military back in 2018. So, halimbawa yung mga nakaka-receive before ng 18,000 pesos, naging 36,000 na ganyan. The problem is not so much with the police compensation. It's the military because of the pension indexation law. Meaning, pag dinoble mo yung basic pay ng active military personnel, you're also doubling the pension. And that's the reason why the pension and gratuity fund is about 190 billion pesos. So imagine that.
Wow. Yeah.
And how can that be corrected? The only way it can be corrected is to reform the pension indexation law. That was in the joint resolution na within a period of nagmoratorium because nagmoratorium dun sa implementation ng indexation ng pension for 1 year. But yung year 2018 ay 2019 balik na sa ganong implementation. So actually, DBM is paying the arrearages to the AFP kasi may utang na pension eh. And unless that is solved, unless the pension indexation is resolved, it will eat up the fiscal space. So magkano yun? I-combine lang natin yung free tuition and just the pension of AFP. We're not saying that AFP doesn't deserve it. They don't deserve additional pay, but there could be another way siguro to to resolve that. Otherwise, it's really not going to be fiscally sustainable for the national government to implement those two very those two fiscal burdens plus the Mandanas ruling. Kasi kung i-add mo, Diyos ko, magkano yun a year? Sabihin natin almost 100 billion pesos na kung wala yung dalawang yon or kung na-reforman lang yung pension, pwedeng pumunta yun sa local government units bilang support sa UHE or perhaps other sectors of society.
And by the way, ay idadagdag ko lang doon sa sinabi ni Zai na yung military pensions na yan, tinry pa nilang isingit yan doon sa Bayanihan 3. So kumbaga, hindi daw nila ipapas yung Bayanihan 3 kung hindi ipasok yung mahigit 50 billion ng military pensions.
Talaga?
Yes.
Oh
So,
my
may article ako dyan sa Raptor.
OMG.
Sobrang triggered ako dyan. So parang...
That's another topic for a webinar.
Ayan.
Kaya kami ni Zai, lagi kaming triggered parati doon sa chat namin. Galit kami parati.
Yes, of course. Ay,
Dagdag ko lang po, at dahil nga sabi ni Saisa, tumataas yung mga sweldo ng mga, let's say, ating PNP or military, lahat ng mga nurses gusto na lang mag-PNP at military. Total, mas mataas naman doon. Mas mauuna silang makakakuha ng plantilla doon. So, yan lang yung mga naging trend din dito sa baba.
So may trade-off talaga, no? Yeah. All right, so Dr. Marilan, I think we're over time na po. But siguro, this was really an economics, a budgeting, a health financing 101, 102 for us.
so real. No, it makes things very real. I know people who died, our colleagues sa health sector. Yan ang nakakagalit. Anyway, hindi ng colleagues, pati pasyente. Marami. Nakakagalit talaga. Anyway.
Sige, Doctor. So on this note, we have to thank our three panelists.
Yes, absolutely. Thank you so much.
But siguro before we end, maybe we could ask to end the note on a happy note, to end the session on a happy note, siguro let's ask each of our participants, words of advice or siguro what can they say, what needs to be done really so that we can see a brighter 2022 for us, and onwards. Maybe a minute each. So let's start off with, nahin naman natin si Dr. Jackie. So Dr. Jackie.
Siguro last words, I think, wag lang tayong mag-give up sa ating bansa. No, let's do our part and be rest assured that Agusan del Sur is doing its part, no? Sabi nga ni Dr. ni 81 provinces, and I hope the 81 provinces, each governor and each provincial health officer and all of the top management in every province support the health sector, no? Because if we have healthy citizenry, I believe mauunlad po tayo as a nation. And also for the health workers out there, hindi po tayo susuko. And we need to also abreast ourselves with the planning and budget skills so that we can also push reforms for health. So yun lang po. Thank you for this opportunity.
Thank you, Dr. Jackie.
We will hear from Zaiza. Zaiza?
Yes. So last few comments ko is two things. First is yung pinag-usapan namin ni JC for the last 2 hours na economic situation, tsaka economic recovery na nasa sentro talaga nun yung budget. Ito yung dapat nating hanapin pagdating ng election debates. Ito rin yung dapat hanapin natin sa mga candidates.
Right.
This should be an issue because
right.
recovery of our country depends on electing a new set of leaders who would be more, evident base, may leadership, may better grasp of governance by actually using the budget as a tool for recovery and
Agree.
development.
Totally.
Oo na. Tapos in relation dun sa Mandanas ruling at saka kanina actually parang natanong ni Doc Tony si Doc Jackie ano yung pwedeng gawin to ensure that health gets a fair share of the pie doon sa Mandanas. I think it really depends on active citizen participation in the budget process, not just
Right.
the national level where kami nila JC where we're at now engaging Congress ganyan, but it has to happen also at the local level. Dapat may active local budget participation kasi kami sa I-Lead nila JC sa chat group namin, we always talk about this. Decentralization and full devolution will only happen if there's meaningful participation by citizens in the budget process. Kasi kung matatandaan natin yung isang slide ni Doc Jackie kanina, it shows us the process of budget preparation. Nandun yung LDCs, but just because there are plans doesn't mean there will be budgets. We see that even in the national government. How much more sa local level? So kung walang magbabantay sa local level, paano mai-implement yung mga plano kung walang budget, kung walang hihingi ng budgets for it. So yun po, those two things lang sa recovery and full devolution daw sabi ng national government.
Thank you, Zaiza. JC, your last words?
Yes, thank you. To end on a more positive note, it's quite encouraging na at least in recent weeks ay may significant reduction in COVID cases na sinabayan ng economic recovery na meron tayong somehow growth na nangyari compared to last year. Although kahit na medyo bumubuti yung lagay ng ating bansa, this is no reason to be complacent. Kailangan we should not let our guards down. And nandito kasi yung patuloy na banta ng other variants, other outbreaks. So we need to put in place a good pandemic response which for the longest time has been denied us by the current government. So I think papasok yung importansya nung susunod na eleksyon sa May na kailangan piliin talaga natin yung mga matitinong leader dahil otherwise ay baka lalong tumagal yung ating recovery. Sinasabi ng NEDA at least 10 years. Pero kung mali yung leaders ay baka umabot ng 15, 20 or whatever. So crucial yung susunod na election, so we should all vote wisely. Thank you sa opportunity na to.
I can't help repeating that. Vote wisely. Vote for somebody who has already a plan in place and has already a proven track record of trying to contain the virus. And you know who that is. I don't have to mention names. Ganito lang siya. Okay. Thank you very much. Thank you. Thank you to everybody talaga. Thank you to everybody. This is a fantastic webinar. Thank you.
Before we end, let's also thank our sign language interpreters.
Yes, Joy and then the other one.
Let me. I wrote his name somewhere here. Well,
Jimwell.
Thank you. So, Dr. Marilyn, thank you very much for partnering with us again. I'm Dr. Tony Bay Faraon po, signing off. Thank you, everyone.
Thank you.
Thank you, Doc Marilyn. Thank you, Doc Tony. Nice to meet you, everyone.
Thank you, everyone.
Thank you.
Initially known as the Population Center Foundation, the Philippine Center for Population and Development was created in 1973 to complement the government's National Population Program. In its first 26 years, PCF implemented projects that delivered information, training, and family planning services. In 1992, the foundation broadened its mandate from population to Population and Development, or PopDev, and it changed its name to the Philippine Center for Population and Development. As a PopDev organization, PCPD implemented projects on community-based health education and services, responsible parenthood, and adolescent development. In 2000, PCPD was reorganized as a grant-giving foundation. It supported the efforts of partners that responded to various concerns, such as housing, waste management, food security, climate change, and reproductive health. In 2020, PCPD decided to shift from giving grants to becoming a social enterprise. It is studying the feasibility of setting up a hospital that would specialize on women's and children's health care, while at the same time provide a broad range of health services to the general public. As it continues to evolve, one thing has remained constant for PCPD. Through its various transformations, PCPD's commitment is to contribute to improve the quality of life of Filipinos.